What you are on a Medicare Advantage plan and you use Walgreens or CVS to pick up your prescriptions or redeem your over-the-counter benefit, you need to stop and watch this right now. In 2026, something changed, and your insurance company did not call you to explain it. Walgreens is closing stores across the country, CVS is restructuring, and at the same time, Medicare Advantage plans from Aetna, United Healthcare, Humana, and others have quietly reduced or eliminated the over-the-counter allowance benefit that millions of seniors depend on every quarter. If you were born before 1966 and you are enrolled in a Medicare Advantage plan, your benefits may already be smaller than they were last year. And if you have not checked your annual notice of change, there is a very good chance you do not know what you lost. This video will tell you exactly what changed, which benefits were cut, how to find out what your plan currently covers, and what you can do about it before the next enrollment window opens.
Subscribe to Nami Finance USA and turn on the bell notification. When Medicare Advantage rules change and benefits disappear, you will hear about it here, not from your insurance company. Here is what happened and why most seniors had no idea. Every year, Medicare Advantage plans are allowed to change their supplemental benefits, the things that make Medicare Advantage attractive in the first place: the dental coverage, the vision allowance, the free over-the-counter money loaded onto a flex card every quarter, the transportation to doctor appointments. None of those are guaranteed from one year to the next. Insurance companies are required to send you something called the Annual Notice of Change, or ANOC, every September before the enrollment period begins. That document lists every benefit change your plan is making for the following year. But most seniors never read it. It arrives in a thick envelope. It looks like junk mail. It gets set aside. And by January, the new benefits, or the new lack of benefits, are already in effect. In 2026, the ANOC sent in fall 2025 contained changes that affected millions of seniors nationwide. According to the Kaiser Family Foundation, the share of Medicare Advantage plans offering over-the-counter benefits dropped from 73% of plans in 2025 to 66% in 2026. Transportation benefits, which help seniors get to doctor appointments, dropped from 30% of plans in 2025 to just 24% in 2026. Meal benefits dropped from 65% of plans in 2025 to 57% in 2026. These are not small changes. These are millions of seniors losing real money and real access, quietly on January 1st. And the pharmacy disruption from Walgreens and CVS made it worse. Why did this happen? Two forces hit at the same time. Force 1, the federal government cut payments to Medicare Advantage insurers. The Centers for Medicare and Medicare Services, CMS, has been reducing reimbursement rates to Medicare Advantage insurance companies since 2024. When the government pays insurers less, insurers respond by cutting the extras they offer enrollees. Bobby Hunter, the CEO of government programs at United Healthcare, said publicly, "The combination of CMS funding cuts, rising healthcare costs, and increased utilization have created headwinds that no organization can ignore." That is the insurance industry's way of saying, we are taking back benefits to protect our profits. According to research from Milliman, a leading actuarial firm, the reductions in supplemental benefits in 2026 were most significant in three categories: dental, vision, and over-the-counter allowances. This was the second consecutive year of decline after years of benefit growth. Walgreens and CVS, where many seniors redeem their OTC benefits, are closing stores and restructuring. Walgreens was acquired by private equity firm Sycamore Partners in August 2025 for approximately $10 billion. By January 2026, Walgreens had already dropped from 8,500 stores to 8,000, a loss of 500 locations. CVS has been closing stores as part of a multi-year restructuring. The company closed more than 900 locations between 2022 and 2024 and continued reducing its retail footprint in 2025. The result? In some communities, especially rural areas and smaller cities, the pharmacy where a senior has filled prescriptions for years is simply gone. And the Medicare Advantage OTC benefit that was supposed to be redeemable at that location cannot be used somewhere that no longer exists. Healthcare advocates and lawmakers, including Senator Elizabeth Warren, have warned that these pharmacy closures disproportionately impact low-income, rural, and minority communities, creating what experts are calling pharmacy deserts. Here is exactly what benefits were cut and by how much. Over-the-counter allowance, the flex card.
This is the benefit most seniors notice first. Many Medicare Advantage plans offered a quarterly OTC allowance, money loaded onto a prepaid card you could use at Walgreens, CVS, Walmart, or through an online catalog to buy vitamins, pain relievers, bandages, cold medicine, and other health items. In 2024, 88% of Medicare Advantage enrollees were in plans offering OTC benefits. By 2025, that dropped to 79%. In 2026, it dropped again to 66% of plans. And for the plans that still offer the benefit, the dollar amount got smaller. Major insurers, including Aetna, Elevance Health, United Healthcare, and Humana, all reduced OTC allowances for many of their plans in 2026. If you are still enrolled in the same plan you had in 2024 or 2025 and you never switched, your OTC allowance may already be lower than you realize or gone entirely.
Transportation benefits. Plans offering rides to medical appointments dropped from 30% in 2025 to 24% in 2026. If you rely on your Medicare Advantage plan to get to doctor visits, call your plan today and confirm this benefit still exists in your current enrollment. Meal benefits. Plans offering meal delivery, important for seniors recovering from illness or surgery, dropped from 65% to 57% of plans. Pharmacy network changes. CVS Aetna's prescription drug plans are now available in 100 fewer counties compared to 2025. Aetna also eliminated nearly 90 Medicare Advantage plans across 34 states for 2026. If you received a letter in fall 2025 saying your plan was being discontinued, you had a special enrollment period to find a new plan. If you missed that window, you may be in a plan that does not cover your local pharmacy, or you may be paying more than you should.
Here is exactly what you need to do right now. Step 1. Find your annual notice of change and read it. If you kept the ANOC your plan mailed you in September 2025, get it out and look at the benefits section. It will show you exactly what changed for 2026, including your OTC allowance amount, your transportation benefit, your dental and vision allowances, and your pharmacy network. If you did not keep it, call the member services number on your insurance card and ask them to send a current summary of benefits for 2026. Step 2. Check your current OTC balance. If your plan still offers an OTC benefit, log into your plan's member portal or call member services. Ask, what is my quarterly OTC allowance for 2026 and how much have I used this quarter? OTC credits typically expire at the end of each quarter. Unused money does not roll over. If you have money left from this quarter, use it before it disappears.
Step 3. Find your closest in-network pharmacy. If your local Walgreens or CVS closed, or if your plan changed its pharmacy network, you need to confirm which pharmacies near you are still in network. Go to medicare.gov/plan-compare and search by your zip code, or call 1-800-MEDICARE, that is 1-800-633-4227, to get a full list of pharmacies in your current plan's network.
What you need to say, if your benefits were cut, compare plans now. The Medicare Advantage open enrollment period runs from January 1 through March 31 each year. If you are still within this window, you can switch to a different Medicare Advantage plan once. If the open enrollment period has already closed, mark your calendar for October 15th through December 7, the annual enrollment period. That is when you can switch your plan for the following year. To compare all plans available in your zip code, go to medicare.gov/plan-compare. To get free one-on-one help from a trained counselor, call your state health insurance assistance program called SHIP. SHIP counselors are not insurance agents. They do not sell anything. They give you unbiased help understanding your options at no cost. To find your state's SHIP hotline, call 1-800-MEDICARE or visit shiphelp.org. Step 5. If your plan exited your county, act immediately. If your Medicare Advantage plan sent you a notice saying it would no longer be available in your area, you automatically qualify for a special enrollment period. This SEP allows you to switch to a new plan outside the normal enrollment windows. Do not ignore these notices. Missing the SEP deadline can leave you without coverage or force you into a plan that does not match your needs. Call 1-800-MEDICARE immediately if you received a plan termination notice and have not yet enrolled in a new plan. Here is the full picture for American seniors. In 2026, the ground is shifting beneath their feet. Medicare Advantage supplemental benefits were quietly cut across the board. Imagine relying on help for groceries or a ride to the doctor. Now, for millions, that help is shrinking. The share of plans offering meal benefits dropped from 65% to 57%. Transportation benefits fell from 30% to just 24%. Even over-the-counter allowances are less common. At the very same time, the corner pharmacy is disappearing. Walgreens, after a private equity acquisition, has already closed 500 stores. CVS is also continuing its multi-year store reduction. For countless seniors, this isn't just an inconvenience. In some communities, the pharmacy where they fill life-saving prescriptions and redeem their dwindling OTC benefits simply no longer exists. A quiet crisis is unfolding at kitchen tables across the country.
Your action steps. Find your 2026 annual notice of change or call your plan and request your current summary of benefits. Check your OTC balance for this quarter. Unused credits expire at quarter's end and do not roll over. Confirm your closest in-network pharmacy at medicare.gov/plan-compare or by calling 1-800-633-4227. If your benefits were cut and you are still in the Medicare Advantage open enrollment period, January 1 through March 31, you can switch plans once. For free, unbiased help comparing plans, contact your SHIP counselor at shiphelp.org or call 1-800-MEDICARE. If you received a plan termination notice and have not acted, call 1-800-633-4227 immediately to use your special enrollment period. If you were born before 1966 and you are on a Medicare Advantage plan, check your benefits today. The insurance company already updated them on January 1st. The only question is whether you know what you still have. Subscribe to Nami Finance USA so the next benefit cut never catches you off guard.